Here are the benchmarks from Phase 3 that you should have already been able to complete prior to moving on to Phase 4. You will notice this is listing all of the exercises from Phase 3. This is the Phase 4 workout summary. We have included the suggested reps and sets to be performed 3 to 5 times per week. These exercises are intended to be performed at the suggested exertion rates and target heart rate zones that will be explained how to calculate in future slides. This is a rate of perceived exertion scale. This will help you to determine the desired intensity of each exercise. It might be helpful to take a picture of this chart for easy reference in the future. If you have any pain when performing a certain exercise, do not try to push through it. Please discontinue the exercise. First, for this exercise, you will need to place your feet on a chair or ottoman. If this is too hard, you can decrease the intensity by placing your knees or thighs on the ottoman, especially if you have less trunk control. Or you could have a partner hold your feet while they are standing so that you are mimicking a wheelbarrow. You will also need a small step stool or a stair to be able to perform the step ups and downs. You will first need to activate your lats when performing this exercise. You will do so by straightening your arms and bringing your shoulder blades together and in a downward motion. Practice this motion a few times before performing the rest of the exercise. You will need to engage this muscle throughout the entire exercise. Second, you will perform the ups and downs with the upper body just as before. You will need to push down with your elbows extended and squeeze your shoulder blades together and downward. Next, you will move one hand onto the step with your elbow bent while shifting your weight onto the arm. You will need to straighten your elbow and start to pick up your opposite arm to bring your arms back to the same level up on the step, with both of your arms straight. Next, to step down, you will need to bring one hand down to the ground or the stair below with the arm straightened and the opposite arm slightly bent in a slow, controlled manner. Once this is done, you can bring your weight onto the lowered arm, bring the opposite arm from the raised surface to the lower surface. Now you have completed a step up and step down. Continue this exercise for the suggested sets and reps. If you are a beginner, you may need to increase your rest breaks. This is the correct way to do this exercise. Make sure that you do not have rounded shoulders or a forward head posture while performing this exercise. If you have any type of pain, stop this exercise. Do not try to push through it. Wood chops are a continuation of the Pallof press exercise. For this setup, you will need a resistance band or a pulley system and a chair near a door. Begin by placing the knot in the resistance band in the doorway above your shoulder height. Make sure to check that the band will not slide through the door before starting the exercise. Now, the athlete will demonstrate the wood chop Pallof press. First, the athlete will grab the resistance band with both hands so that their hands are interlocking. The athlete's arms will start out over her right shoulder and she will pull the resistance band diagonally toward her left hip. Notice that she is rotating her trunk while her elbows remain extended. Think of this motion as chopping wood. Complete this for the suggested sets and reps before switching to the other side. You may need to switch your seating position due to starting the motion closest to the door. This is the correct way to perform this exercise. Do not bend your arms while performing this exercise. Make sure to perform in a slow, controlled motion to allow for the proper strengthening. Do not quickly come back to the starting position after you have completed the chop. For the shoulder press, you will need dumbbells or a resistance band and a chair with a slight recline. If you are using resistance bands, you will need to place the midpoint of the band underneath yourself for where you are sitting. If you place them under the chair, they may slide and become out of place. Next, you will place each end of the resistance band in the respective hand and begin at shoulder level. Your elbows should be bent and in alignment with your trunk. Next, you will bring your hands above your head by straightening your elbows. This is the correct way to do this exercise. Perform this exercise for the suggested sets and reps. Do not perform this with your elbows in front of your shoulders. Do not shrug your shoulders while completing this exercise. Make sure that your shoulder blades are down. The aerobic cardio rows will require the following equipment: a low resistance band or pulley system, a sturdy surface to attach the resistance band to, and a chair. Start by attaching the resistance band to the sturdy surface or in the hinge of a doorway. You want to have 2 pieces to hold, one with each hand, and make sure that it is sturdy before beginning. Now the athlete will demonstrate how to do this exercise. Make sure to start slow to ensure the proper posture and form. The pattern to follow for this exercise is to start with both arms extended, leaning forward in your chair. Next, you will lean back to a neutral posture with your arms still extended. Then flex your elbows and shoulders so that your elbows go just past your sides but are tight against your body. Next, straighten your elbows and lastly, lean forward. This is one complete cycle of a cardio row. Complete this slowly until you get used to the pattern. Once you are comfortable with the form, you can increase the speed. Ideally, while doing this exercise, you should be in the moderate to vigorous heart rate zone. The slide before shows how to calculate your heart rate zone. It is important to remember to monitor your RPE while doing this exercise. That is the correct way to do this exercise. Notice how the athlete involved both movement at her trunk and arms, and you do not want to only move at your trunk, as this will not be a full cardio workout. Now complete this exercise for the previously mentioned duration and intensity. For the floor transfers, you will need a chair or a couch, floor space, and you can optionally include a small stool to make the transfer easier. This transfer will be performed with your back to the surface you are transferring to. Once your back is against the surface you are transferring to, place your right hand up onto the chair while supporting most of your weight with the extended arm that is still in contact with the floor. Next, bring your other hand up onto the chair. It will be helpful for you to really lean forward so that your head is going as far forward as you can so that this will bring your bottom up. Try to complete this as you are bringing your second arm up onto the chair. Next, you will walk yourself back on your hands so that you are fully seated against the back of the chair. If this is too difficult, you may need to incorporate a small stool as an intermediate stepping block to get to the desired surface. This will allow for a small rest break if needed. You will place the stool in front of the chair or couch and then perform the same steps as above. If you have any pain during this transfer, do not try to push through it. Stop the exercise. Do not perform this with rounded shoulders or a forward head posture. Make sure you keep your shoulder blades down. For the pec stretch, the only equipment you will need is a doorway. First, you will bring your arms to shoulder height with your elbows bent at a 90-degree angle, with your palm touching the respective doorway. Your arms should be making an L shape on both sides. Next, lean into the doorway while making sure to keep your ears lined up with your shoulders. You should feel slight discomfort in the front part of your chest and shoulders. This is the correct way to perform this stretch. One can alter the intensity of this stretch by changing how much they lean into the doorway. You should not feel pain with this stretch. If you do, then do not lean as far into the doorway. Do not perform with rounded shoulders or a forward head posture. Make sure that your shoulder blades are down. In summary, these are the exercises for Phase 4. Make sure that you follow the instructed reps and sets for each exercise and the number of times per week you should be doing them. These exercises are intended to be performed at the suggested exertion rates and target heart rate zones that were previously explained on how to calculate. If you have any pain when performing a certain exercise, do not push through it. Please discontinue the exercise.